Hello, everyone. It looks like everyone is here, so we're going to go ahead and start. As you all know, we are doing this group for the next 8 weeks. We'll be meeting at the same time and place every Wednesday, and we'll just be meeting from an hour from 6 o'clock to 7 o'clock. And everyone here today is a caregiver of someone, either a loved one or a family member that has Alzheimer's. So that's why in the individual sessions that I had with you guys last week, you had expressed that you would be interested in doing some group therapy. So here we are. So I would like to introduce myself again. My name is Summer Poteet, and I will be the facilitator of this group. Now, as the facilitator, I'll have a few different roles that I'll be doing. I will be helping us stay on track so we can really stay on the topics. Sometimes I will challenge you to go deeper into the topic that we're talking about. And I also will be doing exercises in each session as well to kind of help us really think a little bit more of what we're talking about. And I will always just really try to make sure that we're being respectful of one another. We may have different values and beliefs, so it's just important to keep that in mind and really try to be respectful of one another. So that is what my role will be as the facilitator. Now, this is your group. So I would like you guys just to go around and introduce yourself. And then also, once you've said your name, I'd like you to say an emotion that you are feeling today, just so we can kind of get a little feel of how you're doing. So who would like to start?
Hello.
Okay.
My name is Brittany Stevenson, and an emotion I'm feeling today is, um, I would just say expected, just maybe to learn something new.
That's great. So eager to learn something new and hope that this group really helps you.
Yes.
Good deal. Thank you, Brittany. Who else would like to go?
I can go.
Okay.
My name is Bianca Stafford. I'm excited just to learn about new things today.
Thank you, Bianca. And what about you?
My name is Ivory Mays, and I am kind of nervous. Yes.
Okay. And nervous is a normal emotion, especially since we don't really know each other that well yet, and this is the first session. So hopefully, throughout this process, you'll start to feel a little bit less anxiety. So,
Okay.
thank you, Ivory. And what about you?
I'm Tiana Hall, and I'm tired.
Okay, and I'm sure that as being a caregiver, that's something that you all have felt before, is just being really exhausted and having a lot on y'all's plate. All right. Well, thank you guys. So since this is the first session, I would like to just go over some basic guidelines. That way we can make sure that this group really flows together really well. So as I mentioned earlier, respect is going to be a very, very important thing, that we just respect one another. If someone is talking, I would ask that you try not to talk over them. Each one of you guys has something, I'm sure, really important to say, and you each bring, although very similar experiences, some unique experiences as well. So it's important that each person gets a chance to talk to one another. Also, it's important that everything that is said in this room is kept confidential. So just anything that's said in here, it doesn't need to leave and going out and telling your family member. Now, if you have something that you yourself have said that you've gotten out of therapy, that's okay to share that. But anything that someone else has said, make sure to keep that confidential. And I do need to just see either a yes or a verbal head nod from each one of you, and we'll start with you, Brittany.
Yes.
Okay. That's great. Okay. And one last guideline would be that we try to keep cell phone use a minimal. Now, I know you guys all do have lives outside of this group, but if we can just within this 1 hour really do our best to keep those phones on silent, that would be good.
I'll try.
All right. Thank you. All right. So would like to get a little bit better feel of what you guys' expectations are going to be from these groups. So let's say after we've gone through the whole 8 weeks, what is your expectation that you're hoping to really get through coming here? And we can start on this side.
I guess just to better coping skills, like, once I'm in this tired, how to just take better care of myself so I can take care of, my family member.
Great. And you actually brought up a topic that we will be talking about today, so that's really good. Okay.
Good.
It would be better coping skills for me as well, and just being more patient.
Patience.
I would say coping skills and learning how to de-stress.
Okay.
I would say the same thing as well as how to be patient, because I know a lot of times just getting overwhelmed and frustrated happens.
Right. And as caregivers of someone that has Alzheimer's, patience is a big thing that we have to have, especially when they're starting to, have that memory loss progress. It's something that you really have to have is patience. And, you guys mentioned feeling overwhelmed and tired and a bunch of things there that I'm sure we can all relate to. So those are some things that we will be talking about. So throughout these sessions, the purpose for you guys as caregivers, we'll be talking about our emotions, feelings, experiences that we've gone through from being caregivers of somebody with Alzheimer's, but then we will also be learning some good therapeutic skills and coping skills as well. So, all right. So I would like to go over what today's topic is really going to be about for this first session, and that is going to be self-care. Now, some of you guys may know what self-care is already, and some of you guys may not know as much, but I would like you to, everyone should have gotten a note card and a pen. Let me know if you don't, I do have extra. Alright. And just take a couple minutes to write down 3 things that you are either currently doing for self-care or something that maybe in the past that you did for self-care that you would like to have time to start doing again. And I'll give you guys a couple minutes to write that. And we've got about 30 more seconds for those that want to finish up. Okay, and it looks like everyone is done. Who would like to share something that they wrote down?
I can go.
Okay.
I said painting. I used to paint some pictures, nothing fancy, like Thomas Kincaid, but, just paint some quotes or something, or just whatever I was feeling at the time. Just putting it on, paintbrush to canvas.
Right. Now, I noticed you said use. Does that mean that's not something that you're currently doing for self-care?
No, because it's not really feasible at this time to go get the stuff and try to work and do it, while I'm taking care of somebody, because it's basically another job, because you come home and you make sure they're fed and, bathed if they need a bath and medications and make sure that they're safe, because, the night time's the worst. So I don't have really time to, that much time between work and basically my second job.
So It sounds like, do you have anyone that's been helping you out?
Sometimes like one of my sisters comes over and helps, and but she's also got a family and kids and a husband, so.
Well, I'd say that's a good break when she does come over to help. It's really important that we have support for when we do need that time for self-care. So that's good. Right, who else would like to go?
I like to get my nails done every other week.
Alright. Okay, good deal. Is that relaxing for you, or how does that seem to help you as far as self-care goes?
It's very relaxing, and when they hit those pressure points, great.
Okay. And I had noticed, it looks like you're still writing actually. I've noticed you've been a little quiet so far. Is there anything you wrote down that seems to help you feel better?
I like to go for a walk sometimes.
And going for walks, how does that help you?
It just allows me to de-stress and think about things.
Good deal. Would anybody else like to share anything?
I'll share one more. I like to drink wine.
Okay, all right. Okay. So, I would like to say just the definition of self-care, in case there's somebody that doesn't really know what that is. So self-care is taking care of your physical, your emotional, mental, social, and spiritual health. And that's through actions, intentions, and behaviors which increase overall well-being. And another simpler definition of what self-care is that it is the care of the self without medical or other professional consultation. So basically, it's just making sure that you are taking care of yourself. So, you don't get sick, you're not stressed out all the time, your mental health, physical, overall well-being. And that's very, very important for caregivers. So I noticed that actually Tiana had brought up that it's something that you used to do. So for this next exercise, I would like us to break up into pairs and talk about some of the barriers that we seem to be facing when it comes to doing self-care. So if you two want to break up into pairs, and then you two let's just talk for a minute and make sure each person gets to say.
Mine was working on writing and reading, and
Or basically home
like or read.
do that, because it's like once I write something,
Usually can work out every,
I just can't get out
2
of
or
it.
3
Like I'm
days a
feeling
week,
else,
but that's still hard.
sometimes I still do, but I just sit there and I'm like, I go into my phone.
Twenty-four hours a day. It's just difficult to want to
I mean, I kind of did them myself this time. They look decent, but it's just the simple fact of,
So if you go like 2 weeks, girl.
I could probably make off for 2 more weeks. Let's see if this Dollar General nail polish does anything. Sometimes I go to the gym though. I'll get a massage.
I like to shop. You like to shop.
Yeah.
I was just a coach yesterday.
And we've got about 30 more seconds to finish up.
Sometimes you just know how excited it's about being fun.
I know.
It's hard.
All right. So would anyone like to discuss some of the barriers that they seem to be facing with finding time for self-care?
Something that me and my partner talked about was obviously time, but then having like backup if we want to go and do something, an extra caregiver. We don't have anyone else that could help pitch in or understand the symptoms or just, what my grandmother's going through. So it's just difficult.
Okay, so I'm hearing time, and then I'm also hearing not only having someone to kind of be that other support to help take care of your grandmother, but actually somebody that really does know her and knows really how to take care of her.
Right.
So okay, and I had seen a couple lines when you were doing that, so it sounds like we may be having some similar experiences throughout this group. So That's good. So would anyone else like to say another barrier that they may be facing?
One that me and my partner discussed is basically like feeling guilty because you are actually having this time to yourself and you want to enjoy it, but you feel guilty because you're not there. You don't get to really enjoy the time, or you only get like an hour to go, and so it's like, okay, I'm taking time for myself, but yet I feel guilty because I'm not there.
So I was actually reading the Alzheimer's Association website today, which if you guys have not visited that, that is a really good resource to use. And one of the topics was exactly what you just said, Kiana. It was about the feelings of guilt when it comes to, as a caregiver, taking that time away for self-care. And that's something that a lot of caregivers do deal with. But basically, it stated, and I want to read this. It says that one of the most important things that you can do as a caregiver is self-care. And that can either be asking family members and friends for help, doing things you enjoy, or getting help even from home help. These actions can help you from getting ill or depressed. There's a lot of statistics that show that people who are caregivers are under a lot of stress, but thankfully there's been plenty of research and things that show that self-care is a really, really good way to help benefit caregivers. All right. Well, we are almost coming to a close for this first session. So I would like to take just a minute to kind of see how you guys are feeling comfortably. I know at the beginning we did how you were feeling in emotion. So I'd like to do on a scale of 1 to 10, 1 feeling very uncomfortable and 10 being very comfortable. Just say the number of how you're feeling about the session, and we'll start with Tiana.
Probably about a 6, kind of like in the middle.
Okay, in the middle, so a little bit comfortable, but not like very comfortable
Right.
yet. Okay,
Right.
all right.
Probably a 5.
Okay, 5, so in the middle still. Okay, all right.
I would say 7.
A 7, so you're starting to feel really comfortable already. Okay, that's really good. And I had noticed, Ivory, you had said at the beginning you were feeling really anxious. So does that mean that a 5, you're feeling a little bit more comfortable now than at the beginning?
Yes.
Okay, that's good. All right. And what about you, Brittany?
I would say about a 6. Just getting to know everyone and being our first meeting.
Right. So we're just going to do a quick summary since this is coming to a close. At the beginning, we kind of got to know each other. I went over my roles as a facilitator, and we went over when we'd be meeting and kind of just what the purpose of this group is about. And then we also went over our topic and talked a lot about self-care. And it seems that we've got a lot of similarities as caregivers. So I would like to ask you guys for any feedback for the next session. If there's a topic that you would like us to bring up, or if there's any feedback you have for me, if you guys just want to let me know, or if you're uncomfortable with that, you can write it on the note card and just leave it on your chair. All right. So if nobody does have anything else to say, I feel like this is a really good start to the first session. It really helps when we have a lot of people that are participating. So I appreciate that out of you guys as a group. It's a very hopeful start for these next few weeks. So I will see you guys next week.
Thank you.
Later.